Hey everyone, it's Abhishek, and welcome back to the channel. Today, we're diving deep into the world of anesthesia with an in-depth guide on the essential breathing tubes used in anesthesia practice. Now, whether you're a medical student, a resident, or a seasoned professional, understanding these tubes is crucial for ensuring patient safety and effective ventilation. We're talking about the tools that help us breathe for our patients when they can't breathe for themselves. Today, we'll explore the different types of breathing tubes, their purposes, and their unique features. So buckle up, grab your notebooks, and let's get started. First up, we have the heavy hitters of airway management endotracheal tubes, or ETTs. Imagine a tube carefully placed into the trachea, bypassing the vocal cords. That's an ETT in action, folks. Why are they so important? Well, ETTs create a secure airway, ensuring that our patients receive a steady flow of oxygen and anesthetic gases throughout the surgery or procedure. But it's not a one-size-fits-all situation. ETTs come in various sizes, with each millimeter making a difference. We choose the right size based on the patient's age, size, and the specific surgical needs. And here's a pro tip. Always check for bilateral breath sounds after intubation with an ETT. That means listening for air movement in both lungs, confirming that the tube is positioned correctly. Trust me, mastering the art of endotracheal intubation is a game changer in anesthesia practice. It's a skill that requires precision, confidence, and a whole lot of practice. Now let's move on to another essential airway device. Next, we have the laryngeal mask airways, or LMAs for short. Think of these as the less invasive cousin of the ETT. Instead of going directly into the trachea, the LMA sits snugly over the larynx, creating a seal that allows us to deliver those crucial anesthetic gases and oxygen. LMAs are particularly useful in situations where intubation might be a bit trickier, like in patients with difficult airways or during short procedures. They're also great for providing ventilation outside of the operating room, such as in emergency situations or in the intensive care unit. Plus, LMAs are generally better tolerated by patients, often leading to a smoother emergence from anesthesia. But remember, every airway device has its pros and cons. LMAs might not be suitable for all patients, especially those at risk of aspiration. That's why it's so important to carefully assess each patient and choose the airway device that best suits their individual needs. Let's talk about the oropharyngeal airway, or OPA, a simple yet incredibly effective tool in our airway management arsenal. Picture this: you encounter a patient who's unconscious or semi-conscious. Their tongue, relaxed and heavy, could easily obstruct their airway. That's where the OPA comes in. This curved device made of hard plastic or silicone is designed to keep the airway clear by lifting the tongue and epiglottis away from the back of the throat. It's like a little ramp for air to flow freely in and out of the lungs. Inserting an OPA is a relatively straightforward procedure, but it does require proper technique to avoid complications like trauma to the mouth or throat. OPAs come in various sizes to ensure a snug fit for patients of different ages and sizes. Remember, the OPA is a temporary airway adjunct. It's not a substitute for definitive airway management like an ETT or LMA if the patient's airway is compromised. Now let's move on to its close relative, the nasopharyngeal airway. Now let's talk about the nasopharyngeal airway, or NPA, another essential tool in our airway management toolkit. Unlike the OPA, which is inserted through the mouth, the NPA is gently passed through one of the nostrils and extends into the nasopharynx, the space behind the nasal cavity. The NPA is particularly useful in patients who are semi-conscious or conscious, as it's generally better tolerated than an OPA. It's also helpful in situations where the patient might bite down on an OPA, such as during a seizure. Just like the OPA, the NPA comes in various sizes to fit different patients comfortably. Choosing the right size is crucial to avoid complications like nasal bleeding or pressure sores inside the nose. Remember, using a water-based lubricant can make insertions smoother and more comfortable for the patient. Now let's explore some more specialized airway devices. Shifting gears now to a more specialized type of airway, the endobronchial tube. These tubes are like the precision instruments of airway management designed for specific scenarios, particularly in thoracic surgery. Imagine this: a patient requires surgery on one lung. We need to ensure that the healthy lung continues to function properly while we operate on the other. That's where endobronchial tubes come in. These tubes have a double lumen design, allowing us to ventilate each lung independently or even isolate one lung completely. This is crucial for procedures like lung resections, where we need to deflate the affected lung to access it surgically. Endobronchial intubation requires a skilled practitioner, as it involves navigating the tube through the trachea and into the correct bronchus. It's a delicate procedure that demands precision and a thorough understanding of airway anatomy. Now let's move on to another specialized airway device. Now, let's talk about tracheostomy tubes, which are designed for long-term airway management. Imagine a patient who needs mechanical ventilation for an extended period or has a condition that makes breathing difficult. In these cases, a tracheostomy tube provides a stable and reliable airway. This tube is surgically inserted into the trachea through a small incision in the neck, bypassing the mouth and throat. It's a lifeline for patients who require prolonged respiratory support. Tracheostomy tubes come in various types and sizes to accommodate different patient needs and anatomical variations. Caring for a tracheostomy tube requires specialized knowledge and skills, from cleaning and suctioning the tube to managing any potential complications. It's a team effort involving doctors, nurses, respiratory therapists, and of course, the patient themselves. Now let's discuss the final essential component of airway management. While not tubes in the traditional sense, respiratory masks play a crucial role in anesthesia and airway management, especially for delivering anesthetic gases and oxygen non-invasively. Think of these masks as the gentler approach to airway management. They form a seal over the patient's nose and mouth, allowing us to deliver a precise mixture of gases to keep them comfortable and safely asleep during a procedure. From simple face masks to more specialized ones like the Venturi mask, each type serves a specific purpose. For example, a simple face mask might be used for short procedures or for oxygen delivery, while a Venturi mask allows for more controlled oxygen concentrations. Selecting the right mask and ensuring a proper seal is essential for effective ventilation and patient comfort. And remember, even though masks are non-invasive, patient education and reassurance are key to reducing anxiety and promoting a smooth experience. Now let's wrap up our discussion on these essential airway devices. Thank you for joining us on this journey through the essential breathing tubes in anesthesia. We've covered a lot of ground today, from the intricacies of endotracheal intubation to the importance of respiratory masks. Remember, the right choice of tube can make all the difference in patient safety and effective ventilation. It's about understanding the unique features of each device, assessing the patient's individual needs, and applying our skills with precision and care. Don't forget to like, subscribe, and hit the bell icon for more informative content. Stay tuned for more medical insights, and until next time, stay curious.